Kaunti ya Nyeri ni imwe ya kaunti iria ica ikuhi ciambiriirie kwandikithia namba nene ya arwaru wa murimu wa Covid-19 ikiro kia ugwatania kaunti-ini ino ikirugamira gicunji kia 35 hari igana. Kuringana na Ngabana wa Kaunti ya Nyeri Mutahi Kahiga, thibitari imwe cia kaunti ni cihurite arwaru wa murimu uyu wa Covid-19 kuria gukinyaniria na riu Kaunti ya Nyeri yandikithitie arwaru 2,592 na ikuo 156.
The County Department of Health has also noted with concern that some COVID-19 patients are self-medicating at home only to present at our hospitals late with the complications leading to poor outcome. And at that point I would want to mention that we have observed a situation where majority of our patients are dying within 24 hours of getting to hospital.
Thukuru wa sekondari wa Ngorano kaunti-ini ino ni uhingitwo thutha wa arutwo 100 kwonekana na murimu wa Covid-19 na kuringana na Ngabana, arutwo aya ni marikitie kuinuka, aciari makiurio kumenyerera ciana micii-ini.
An outbreak of COVID-19 was reported in a local secondary school, which is Ngorano Secondary School, where we recorded a positivity rate of 88% among the students. Unfortunately, despite the rising burden of COVID-19 disease, we have witnessed worrying trends of reduced adherence to public health measures among the general public, which largely fuels the transmission.
Maya mokite oriri kiama gia clinical officers kiuritie thirikari kugiria micemanio yothe ya kiuteti itemi-ini ria kunyihia kwambatira gwa gikiro kia ugwatania wa murimu uyu guku bururi-ini undu umwe na kunyihia namba nene ya arwaru iria irandikithio.
Our politicians must know their leaders, and leadership includes protecting the lives of the people they seek to lead, because you cannot lead people who are dead.
Vipimo vyetu hatujawahi kuongeza, tunaendelea kupima chini ya 5,000 kila siku, na hii haiwezi onyesha taswira kamili, na hizi vipimo vyote vingi vinafanywa katika kaunti karibu 3 peke yake. Kaunti zingine hazina uwezo.
Andu 1,068 ni monekanite na murimu wa Covid-19 umuthi na gukinyaniria ithabu ria arwaru aria andu 219 aria marwarite guku bururi-ini ikiro kia ugwatania ikirugamira gicunji gia 14.4 hari igana, andu 349 makihona, ithabu ria andu othe mahonete aria andu 148 222 arwaru 15 magikua na be andu othe makwite aria andu 3,910.
Most of them had very mild
Girifotera Kameme TV, retorokoni wa Juru wa Foro.
disease and some were symptomatic.